Hello, and welcome to this Google Hangout. Today, thank you so much for joining Girls Globe and Women Deliver for this Google Plus Hangout on how youth are leading the way. My name is Julia Wiklander, and I'm the founder and executive director of Girls Globe. We're a global network of young people, bloggers, and organizations that are working to raise awareness about the rights, health, and empowerment of women and girls around the world. In less than 1 week, the Partnership for Maternal and Newborn and Child Health Forum will take place in Johannesburg, South Africa. The PMNCH Partners Forum will gather global leaders, policymakers, global health professionals, activists, and youth from around the world to unite in the global conversation towards improving the lives of women, newborns, and children. At the forum, progress will be reviewed, success factors will be identified, and action will be recommended to address the gaps and how we can continue and how we can accelerate progress to save lives. Several reports will be released during the forum, including the Countdown to 2015, the Success Factors Report, and the Every Newborn Action Plan. This Every Newborn Action Plan builds from the evidence from the Lancet's Every Newborn series that was released earlier this year to create a roadmap and a joint action platform for reducing preventable newborn deaths and stillbirths. And in support of every woman, every child, the forum will be an important opportunity to establish a strategic vision and to align partners across health and all sectors to ensure that women, adolescents, young people, children, and newborns live healthy and healthy lives, and that we can hold our leaders accountable, and that all of these individuals who are a core of our world are at the heart of the post-2015 development agenda. And in addition, young people from around the world have gathered to align their priorities for the post-2015 agenda, including recommendations of action that should be taken to improve sexual, reproductive, maternal, and newborn health. We are thrilled to have two young leaders in our Google Hangout today that have been a part of developing a youth framework paper that will be delivered to global leaders during PMNCH. And before I let our panelists introduce themselves, we have Kelly Thompson, who's calling in from New Jersey, and we have Yemurai Nyoni calling in from Zimbabwe. Before I let them tell you more about themselves, I would like to encourage all of you to join the conversation online. Whether you're watching this Hangout live or after it has been recorded and saved on YouTube, join the global conversation this week and during the Partners Forum using the hashtag PMNCHLive. I would also like to encourage all of you to sign up to the daily delivery emails that will go out to anyone who signs up, and it includes curated coverage on the topic of accelerating progress for women and children. You can sign up by visiting the website crowd360.org/PMNCHLive. The emails and the hub that you reach at that website includes all of the updates coming out of PMNCH, including voices from youth. And it is a joint initiative by FHI 360, Johnson & Johnson, PMNCH, Women Deliver, and Girls Globe. For those participating and listening to the Google Plus Hangout Live today, we would love to include your voice in the conversation and respond to your questions. So please feel free to ask questions in the comment box, which is here on the Google Hangout page, or via Twitter using hashtag PMNCHLive, and please tag Girls Globe. And at Girls Globe, we really believe that youth can be a driving force for global change as we are given opportunities to raise our voices and advocate. And there are 3 billion young people under 30 on the planet today, mostly in developing countries. And today's generation of young people is the largest in history. These individuals it represent both the present and the future of our world. So we're really happy to have an amazing panel of youth activists joining us today. So to begin with, I would like each participant to take about 30 seconds to introduce yourself and share your background. We can start with Kelly.
Thank you, Julia. I'm Kelly Thompson. I'm a fourth-year medical student at the University of Sydney, and I'm currently working with the International Federation of Medical Students Associations, also known as IFMSA, as the Liaison Officer on Reproductive Health, including HIV/AIDS. And I've been working together with Yemurai and PMNCH on adolescent health, and then more with a broader group of young people on developing a post-2015 framework for young people and for adolescents.
Great, thank you. And Yemurai.
My name is Yemurai Yoni. I'm a youth advocate from Malawi, Zimbabwe. I lead an organization called Dodge Youth. The aim is to harness youth innovation for social transformation. I also am part of the Adolescent Advisory Panel of the Fellowship for Maternal and Newborn Child Health. And through that, we've been working to help frame discussions around maternal and newborn child health as it relates to adolescents, to make sure that as we discuss around the post-2015 development agenda, as we discuss around even regional campaigns that have to do with youth development, to make sure that these issues are at the forefront. So basically, I'm passionate about change, and I've been involved in a lot of work around mobilizing leadership for reproductive health.
Thank you, Yemurai, and thank you, Kelly. Thanks both of you for the work that you're doing to empower young people and to make their voices heard, and especially in this conversation regarding sexual and reproductive health and maternal and newborn health and child health. So I would like to ask you a few questions. And I'll start with you, Yemurai, and I wanted to ask you why you believe it's so important to include a young person's perspective or youth perspectives in the post-2015 agenda.
Well, first of all, the next 15 years will be lived by us as young people. And I don't mean this in a sentimental way, but actually we are the ones who infiltrate the job market, we are the ones who lead families, we're the ones who lead different political structures. So this framework belongs to us in essence. Our involvement in this framework makes sure that we can be held to account in the next 5 to 15 years. It also ensures that we are actively involved in making sure that the goals that are set are followed up on by the current leadership and by the future leadership. So basically, that's the framework that we have. Involving youth now makes sure that everything that's done is relevant to the future that young people will experience.
Thank you, Yemurai. And Kelly, I'll turn that over to you because you've also been a part of developing this framework. And how do you, tell us more about the framework and tell us what the next steps are.
So the framework basically came out of the idea that there's these formal post-2015 processes, and there's 6 different streams that are all feeding into the Secretary General's office, and that will be overseeing kind of the final writing of the Sustainable Development Goals that will be negotiated by governments. And we noticed that when we were attending open working group sessions, that the things that were being reflected about young people and what young people wanted weren't actually what we had heard young people saying at different meetings and through their declarations. And we also realized there wasn't much evidence base around what people are asking for young people. So we decided that we really want to create this evidence base, and we want to see what young people really want as compared to what is actually happening in the post-2015 process. And so we analyzed a group of youth statements, and then from that we developed kind of 13 overall focus areas that young people had said in all these different statements that they want, and then compared that with what was happening in the formal post-2015 process. And from there, we found some gaps that we kind of knew were going to be there. And then we're just working now to finalize the recommendations of what we think the post-2015 process should look like for young people, and more specifically for adolescents. So the idea is really that adolescents should be the key group that post-2015 is looking at, because the Millennium Development Goals were able to really address under 5 mortality, and now we have all these young people, these children that are living longer, and they're going to be living into this adolescence, but there isn't enough focus or any ideas about what we're going to do about them when they enter their second decade. So we really want to make sure that governments are thinking about this population, and it's a youth bulge at the moment. So the kind of next steps will be developing a advocacy plan and kind of going forward, utilizing some different mechanisms like the Partners Forum, where we'll have some youth engagement activities, and linking into other things like the PACT, which is a collaboration of 25 youth organizations working on HIV, and linking into broader work that our other youth organizations are doing around post-2015.
Great, thank you. So would you be able to share some of the recommendations that are included in the youth framework? And what do you see as the biggest priorities for the post-2015 agenda?
Sure. So only kind of in the works, but in draft form. But we saw that the biggest gaps were actually around sexual and reproductive health, and particularly sexual and reproductive rights. And young people are often asking for access to contraception or access to safe and legal abortion services, and there's very limited discussion of this, or it's quite a big fight at the UN at the moment about these issues, and we see that as kind of one of the biggest barriers to young people accessing these services, is that it's not recognized as a human right. So we're recommending that governments really take this on as a human right, and see sexual and reproductive health and rights of young people as a marker of development, and if you're not achieving that, then you haven't achieved development. And then there's other kind of more broader things about access to healthcare services for adolescents and young people. So there's a lot of talk around universal health coverage, and just making sure that when governments are putting into place their universal health coverage, that they're actually addressing the needs of different populations. So making sure you have youth-friendly services as part of your kind of overall package of services. And then there's other things like ensuring that there's meaningful youth engagement, so making sure young people are involved in decision-making processes that go around that affect them particularly, and making sure that, you know, if you're allocating funding somewhere for a youth program, that you're actually interacting with young people and with adolescents, and making sure that program is something they'd like to see. And then, I mean, just broader issues around addressing social, environmental, and political determinants of health, and making sure that young people have access to secondary education, and making sure that they have employment, which are issues that are actually being recognized at the moment. And then the other big thing is for us that HIV is increasing amongst adolescents, whereas in other populations the rate of infection and deaths are actually going down. For HIV adolescents, it's actually going up. In between 2005 and 2012, that number has gone up by 50%. So we just want to make sure that governments are reaffirming their commitment to ending AIDS, and making sure that the main group that they're focusing on ending AIDS in is adolescents, because we see this as a major public health emergency.
Thank you, Kelly, and thank you. And I have many more questions, but I would like to turn to Yemrai, because I believe that to make this and to put hopefully all of this will be included in the post-2015 agenda, but how do we actually mobilize young people in various countries to hold their governments accountable? Because I think that every country and every country is different, and we have different challenges in different parts of the world. So I would like to ask Yemrai about your experience in Zimbabwe, of how can we actually mobilize young people, and how can youth action be taken from just having perspectives to actually becoming action and also holding leaders accountable locally. And I know that that is some work that you've done in Zimbabwe. So do you have any recommendations to share?
Yes, thank you for the question, Julia. I'll say the key from our experience. I spent about close to 4 years working in a youth network called the Young People's Network on Sexual and Reproductive Health, HIV and AIDS. And through that, we're able to mobilize the work of different youth associations and youth organizations involved in work around education, employment creation, work that had to do with involvement in child governance. And through that, we're able to set up multi-sectoral partnerships within the constituency of youth. And by doing that, we're able to bring to the fore, like, for example, within our platforms, different issues affecting different youth in different contexts. And that made it possible for us then to take a step further and move into decision-making bodies. So we're involved in technical working groups set up by different ministries. We're also involved in strategy development processes because we managed to organize our voice at local level. So the first thing for us is to make sure that when we speak together. There's no space at the moment for us to be dispersed and focusing on small, minute movements. We need to come together. We have coalitions at regional level. For example, the AFRIAN, which is the African Youth and Adolescents Network on Population and Development. We have the Youth Coalition on Sexual and Reproductive Health and Rights. We have the International Federation of Medical Students. And all these different associations allow us to have a collective voice. And when we speak them, we are able to speak more accurately based on the perspectives of those that work with our associations. It's also important to be strategic. We have a lot of processes taking place now. A lot of them new internal consultation processes. So our involvement in build task teams that are working around the post-2015 development agenda and related discussions to do with ICPD beyond 2014 has helped us put most of the issues around sexual and reproductive health.
Thank you, Yemrai, and I think that your experience is so valuable, and I think that just sharing those best practices is really, really important. And I know that Yemrai is also a Women Deliver young leader, and Women Deliver has an amazing youth platform and a lot of recommendations for young people to get involved in these questions of sexual and reproductive health and rights and women's health and well-being. So thank you, Yemrai, for the work that you're doing in Zimbabwe and also regionally and also as a global advocate for these issues. So I would like to ask further, what main issues can you, I'll direct my question to Yemrai first, and as your country, Zimbabwe, and also your region, what key health and rights issues do youth experience in your country that you see are a priority to be addressed in the post-2015 agenda?
Okay, thanks again for that question. It's got me thinking. Well, the first issue for us has been access to comprehensive sexuality education, which is age appropriate and is able to make sure that we as young people make informed decisions around sexual and reproductive health. We experience successes internally. Our Ministry of Education has launched a strategy around sexual and reproductive health information, making sure that information is available to you. But still it remains because curriculums have still not been updated. And this also is a regional issue. I was recently at the 47th session of the Commission on Population and Development. And the African bloc was still negotiating on whether or not this is necessary to agree on availing comprehensive sexuality education. So for us, we believe that is the non-negotiable in the post-2015 development framework. Comprehensive sexuality education is an entry point to life-saving sexual and reproductive health rights and services. We need to make sure that every young person makes an informed decision about their health and about their future. In as much as it's the same way as we prioritize universal primary education, possibly universal secondary education, we must also make sure we prioritize comprehensive sexuality education. Also, broadly, is the issue of providing youth-friendly sexual reproductive health services. Youth-friendly, that means the friendliness of that service would be defined by young people, and the service providers would be held to account by young people. So the discussion around providing services for young people should strongly be linked to issues of accountability and issues of defining the appropriateness of those services, and issues of making sure that the services are accessible at a cost that we as young people can bear, and in terms of geographic location, all these things must be catered for. And we also need to ensure that in our indicators that will be developed, it's easy for us to keep a tab on how many young people are actually able to access services. And the final key issue is around youth participation. And this is very critical. There was nothing of this nature within previous development frameworks. And I think we need to begin to bring that clearly onto the table, define in which context we need this participation to exist, how we'll measure its impact, and that way we are able to bring in people also onto the decision-making platform. The final thing is it has to do with dealing with harmful cultural practices affecting children and youth. This includes specifically early and forced marriage. I think the recent launch of the African Union campaign on ending child marriage is an indication of how this is fast becoming a clear, non-negotiable in terms of making sure whatever development framework we're creating allows for the elimination of harmful cultural practices like child marriage, which goes against almost all of the previous development goals of the MDGs. So we must make sure that we do these 4 issues for us are prioritized. I'm sure Kelly though will have a few additions on that.
Thank you, Yemarai. Yeah, and I think that it's really important to, when talking about the post-2015 agenda, and especially the health and well-being of women and children and adolescents, to, of course, have a human rights aspect and really look at those human rights violations that are specifically directed towards young people and young girls, including child marriage. So thank you, Yemarai, for the work that you're doing to advocate against that. And Kelly, what would you see, what additions do you have, what issues do you see that need to be addressed in the post-2015 agenda regarding the health and rights of young people?
So I think Yemarai did a very good job of kind of covering everything with addressing not only social determinants of health, but also discussing culture. And I think culture is something that's used as kind of a catch-all for when people don't want to agree to things. And I think it's really important that in the post-2015 agenda, people realize what using culture means for limiting people's rights, and not saying to tramp on people's culture, but to make sure that your culture is actually promoting the well-being of people in your country. And then the only other kind of thing, in addition to the sexual and reproductive health thing, is the kind of emerging need to discuss healthy lifestyles and health promotion, and making sure that for adolescents particularly, and for young people, that this is a really key age for them where if their healthy lifestyle isn't addressed at that point in their life, then they are statistically going to go on to be unhealthy kind of adults, so that they're with non-communicable diseases, issues like obesity and things like that. Studies have shown that if you can address those issues in late childhood and early adolescence, then you're going to have a much healthier adult population, but if you don't address those issues after adolescence or during adolescence, then kind of those issues are left behind. So just really making sure that the post-2015 agenda is really cognizant of who the goals are going to actually affect ultimately, and that if we're not addressing this population more specifically in our implementation, then we won't actually be able to have this progress and this development. And the other big thing actually that I didn't mention before is data. So we're talking a bit about being evidence-based, and for looking at adolescents and looking at young people, whether it's around health or if it's around other issues, there actually isn't enough disaggregated data, especially for young people between the ages of like 10 and 15 and 10 and 19. So even like one of the biggest struggles that they mentioned in the report for the recent WHO the Health for the World's Adolescents report, they talked about their biggest struggle is that there isn't enough really good data, and it's because we're not disaggregating the data and looking at young people particularly. So like I used HIV before as an example, but that if you look at HIV as an overall trend, it's going down, but when you actually extract that data and look at it for young people, it looks really bad. So the key, I think, in the implementation and then monitoring and evaluating of these goals is that we actually have to make sure that we're assessing the populations that need to be assessed the most. And also in saying that, looking at kind of more marginalized and vulnerable populations. So universal health coverage might be getting 80% of those people, but there's a big fear that the 20% of people in a country that are left behind are those people who actually need those services the most. So whether they're refugee or migrant populations or LGBTQI populations, and we see like young girls and young women as a vulnerable, marginalized population as well. So really making sure that if we truly want to have a development goal for all and different goals that we want them to be universal, it has to be universal for everyone. So really making sure we address those populations.
Thank you, Kelly. And I think that it's really great how you mentioned that we need to have a goal that is specifically targeted towards young girls and young women, but then also looking into how to be able to get those goals and be applicable for several regions around the world, because regions are different, and then it's also depending on marginalized groups and other groups in society that are also affected differently. So my follow-up question to you, Kelly, would be, how do you think that we can actually have post-2015 targets and goals and targets that are actually applicable for the whole world? Because there will be global goals, but how do we actually make them applicable for every region when it's actually, there are such differences from region and also from different regions, but also urban and rural, and of course then young people and other marginalized groups. How do you think we can make that possible?
So that's a very difficult question, and one I suppose that they've been struggling with here in New York, because there's a lot of issues and a lot of things that need to be addressed, but how do we make sure it's kind of a catch-all for everything? So I mean, I think overall that the goals need to be aspirational. So once they're aspirational and they're a bit broad and maybe they might seem unachievable, that having them be something that we think that we can never get to is pushing us forward to make sure that we actually can get to it. And I think the making sure that they address the issues in different regions and in different national contexts, I think across the board that we have some of the same issues. So Yemerai was talking about issues around accessing sexual and reproductive health services. And now I'm back in the U.S. living here for a little bit, and we're still having the same issues here in the U.S. about young people or women being able to access services. So I think a lot of the issues are actually applicable across all countries. But also I think if we want these goals to be something innovative and exciting for people, is that even though they're aspirational, that we actually want to make sure that there's strong support in country to be able to apply them, and to make sure that countries actually know what does it mean when we're saying we want this, and how does it look in country. And I think that's up to not only countries themselves to kind of make sure they have that support, but also for countries that might be donor countries or who have kind of a stronger civil service that has a stronger understanding of academics and statistical analysis of these things, making sure that there's kind of a cross-country and international cooperation on making sure things are actually being implemented and that they're working. And I mean, that brings us back to kind of to what Yamarai was saying about holding our own governments accountable, and this is where young people can play a really major role, and that's making sure that we know what our governments have agreed to, and that we know what our governments are doing in country and in the region, and that we're able to follow them up. So I probably didn't really answer your question, but hopefully some ideas around it.
Well, it's a difficult one, and I think that all the work that we can do to really advocate for a good post-2015 agenda where our leaders are really held accountable and that we can have targets that are measurable and that we have data to accompany those targets as well. I think that the work you're doing is amazing. And so I just want to move back a little bit towards youth activism and how young people can get involved. And I wanted to ask Yamarai, how do you see that social media is actually changing the way that young people can actually become involved in activism?
Okay. First of all, I think I have to appreciate Kelly and the comments she made. That was very elaborate. Well, in terms of the work of social media, I think it's a gift to the movement around IFMSA, because we've practically opened the decision-making and change-making landscape to bring everyone on board. It's given us an opportunity to amplify the work we're doing. For example, under the Rising Bird project that we're carrying out under this Women Deliver Sea Exchange initiative, we have an online petition that all people are able to give direct input to. So it's allowed us to connect to people with very affordable, cheap, sometimes free way, to make sure that the work that we do doesn't cost as much and makes a greater impact. But also, I think it's a good platform to hold leaders accountable. A lot of our development agencies, our politicians are available on social media, and it gives a direct link to them for us to know the work they're doing, for us to ask questions, for us also to be able to pose questions within our different audiences that other people can be engaged in. I remember at some point sending an email to, or actually sending a Facebook message to the then Minister of Education, and he responded to it, and the result of that was speeding up the launch of our Ministry of Education, Sexuality, or Sexual Reproductive Health Education Strategy. And for me, that's basically the experience around social media. It's opening doors. But then again, it's not a card that we can overplay, because sometimes we get caught up in the cloud of the work we can do within social media, so much so that we forget the work that needs to be done on the ground. So I think it's very critical to make sure that whatever we are doing on social media is tied closely. The offline groundwork that we do, the meetings we have, the engagement we have with young people, the posters that we put out there, these things will work hand in hand, and if we find the balance, I think we'll make the progress we need to make.
Thanks, Yamarai, and I completely agree with your comments there. And I really think that social media, of course, it has to be linked to what is being done on the ground and offline, because that work that is being done is already amazing, and I think that social media is an efficient way to support that work. And I think anything that we can do online to just create more attention and more resources to what actually is being done on the ground is fantastic. And social media, of course, for Girls Globe has meant so much, because we wouldn't exist if it wasn't for social media. And we've just created a global network of bloggers and activists who actually all connected via Twitter, pretty much. So it's an amazing tool to actually mobilize and create those networks and strengthen existing networks that are on the ground, to not only have national and regional, but also to be able to create those global networks that I know Women Deliver is also doing, to be able to continue to advocate and create new partnerships for change. And I think that the alliances that we can create through social media is really powerful as well. So one final question before we sort of round up this great conversation that we've had with the two of you. I saw that we just got a question in from our audience, so I'll just ask that as well, and if you can be brief in your response. And the question is, so if you have specific recommendations of what youth can do in their communities to take action and advocate for maternal, newborn, and child health. Kelly, do you want to answer that?
Sure. So I think ultimately for us, for the next kind of round of advocacy for post-2015, starting after the last open working group in July, it's really going to go back to the country level. So it's going to be intergovernmental negotiations. So I think for young people in their community, what they can do is gather and talk with other young people and really have an idea of what they see as their priorities, but then also link that into these broader things. Like we're saying, this framework will be available online. There'll be things available on social media that you'll be able to see what other young people want to do. And then use that opportunity to link up with other youth groups in your community and even on a larger national level, and join together and talk to, whether it's your like the mayor of your town or somebody, or get people together and try and get people to go to Capitol. I think like the power belongs with those young people in their community, because they're able to say, this is what we want and this is what we want to see reflected. And then also using yourself in your community as the measure of what's actually happening, and making sure that you are holding your government accountable within your community, because you'll know best what's actually being achieved and what's not being achieved. And in the next 15 years, using social media and using all these opportunities to tweet out, like, my government said that we were going to get a youth-friendly service, but we've been waiting 5 years in this community and we haven't actually seen anything advancing. And I think that's really the power of where you can take your community work together with social media, but also trying to link yourself into the broader movement and linking up with what young people have been doing. It will be really helpful in making sure that we can all work together to achieve this, because there's people everywhere, young people wanting to get involved, and making sure that you're linking up and having a stronger voice is really important.
Thank you. And I think that especially encouraging young people to advocate for their leaders to do what they've said that they will do is really important. And I know that Every Woman, Every Child is leading an initiative called Commit to Deliver. So they're encouraging people to use the hashtag Commit to Deliver, and say like how they think the leaders should commit to delivering for maternal and newborn health around the world. So to conclude, I wanted to ask both of you what action and accountability you hope to see from leaders as in the post-2015 agenda, and also what you look forward to during PMNCH. So what action do you hope to see in the post-2015 agenda? It's of course a big question, but and what do you look forward to at PMNCH this week? Yamarai.
Okay, I think I'll start with what I look forward to in the PMNCH Partners Forum. I think I expect increased engagement and open conversation. I hope we'll also be able to get a lot of stimulating questions from the youth leaders who will come through, and get equally insightful answers from the adult leaders who will also come on board to help bridge the gap in terms of what's not being done on the ground, what should be done, and what will or can be done. I also expect to see solid commitment Now is a point where we need a lot of decisive statements that are very clear and concise, evidence-based, and measurable also. So I expect our leaders to be very, very specific and know exactly what they want to do in the next 15 years on IFMSA. Then in terms of your first question, sorry, Julia, I missed the first question.
I believe you've answered the first question a few times during the call that we've had, but just in a brief 2 sentences, what action do you hope leaders will take in the post-2015 agenda?
I expect solid accountability for every declaration that governments have agreed to, specifically around human rights. I expect to see that reflected in laws. I expect to see that reflected in local strategies. I also expect to see that reflected in the funds that will be released for programs around IFMSA.
Thank you, Yamrai. Thank you so much. And Kelly, what do you look forward to for PMNCH this weekend or this coming week, and what action do you hope to see leaders take in the post-2015 agenda?
So for myself, I'm really looking forward to being able to get together in person with a lot of the young leaders that we've been working kind of online with, and actually developing kind of a strong plan and advocacy plan for going forward in the next few months and the next years. So that'll be really exciting. And then also the opportunities that we have to interact. There'll be some kind of really high-level people that will be attending, so this is an opportunity for us as young people to also make sure that they're listening and they know what our needs are. And PMNCH has helped us facilitate some different dialogues with the leaders, so really making sure we use those opportunities to have our voices heard. So it should be a pretty good 2 days, and I'm really looking forward to it. As far as the leaders in the post-2015 process and developing the agenda, my hope and my wish is that they listen to the people in their communities and the people in their country, and those people who have been really vocal are young people, and seeing that young people know what they need and have kind of really organized themselves and have a strong idea of what they would like to see this process. So for the leaders to don't kind of politicize our health and don't politicize our issues, but instead really tackle them and make sure that the issues that they think are tough to move forward are actually the issues that we care the most about, and we want to see them reflected in post-2015, because we know that they're really what is going to lead to true development and true equity and equality throughout the world. So making them really not be afraid to take on the tough fight, I think, is my big hope.
Thank you, Kelly. Thank you both. Thank you, Kelly. Thank you, Yemrai. Thanks for the work that you're doing, and I'm looking forward to meeting both of you at PMNCH. And I'm looking forward to the panels and the youth voices, and really getting that perspective throughout PMNCH this year. So thank you both for participating in this conversation today. Your expertise and your leadership is really valuable. And I would also just like to remind all of us who are watching, all of you who are watching, to go to crowd360.org/PMNCH live. That is where you'll find all of the updates from PMNCH, all of the reports that come out, blog posts from young leaders, and it's also the place where you can go to sign up to the daily deliveries and get all of the updates directly into your inbox. So I recommend you to go there, and I also recommend you to join the conversation and to make your voice heard throughout this week online using the hashtag PMNCHLive. And Girls Globe and many of Women Deliver's young leaders will be on the ground at PMNCH, and we will be sharing blog posts and highlighting the youth perspective throughout the summit. Girls Globe will also be speaking with youth and hosting several live-streamed Google Hangouts live from Johannesburg. And we'll be kicking off with Google Hangout at the Youth Pre-Forum, which takes place on Sunday the 29th. And we will also be hosting Google Hangouts from the Youth Zone that is at PMNCH during the days of the summit. So I just want to call out and inspire you all to raise your voices and contribute to this conversation and take action in the ability that you can. And I look forward to the conversation that we'll have this weekend at PMNCH. Thank you all for watching, and thank you again, Kelly and Yamarai, for participating. Thank you.